Nigerian experts working at institutions in country and around the world have developed recommendations to reposition future policy to achieve universal health coverage and better health for all Nigerians. The initiative, Lancet Nigerian Commission, Investing in Health of a Nation, will be set in motion by Nigeria's Vice President, Professor Yemi Oshibajo. Now, right here in the studio, we have Professor Ibrahim Abubakar, Dean Population Health Sciences, University College London, joining us in the studio as he's also, the Commission's lead. Good morning and welcome to Daybreak.
Good morning. Thank you very much for having me.
It's nice to have you on the program. So could you talk to us about what the initiative is all about and how do you plan to champion that cause?
Yes. So we, a group of us Nigerians, both within the top universities here in the country and in the diaspora, decided that given the many health challenges facing us, and there is no shortage of health challenges in the country, that we needed the thinking space to come up with new ideas about how we can tackle these challenges. And together we've worked over the last 2 years to come up with a list of major recommendations which we would advocate to policymakers. We, in preparing our recommendations, consulted widely different sectors of the country, the youth. We spoke to individuals who run the health system at independence, all the way to people who are currently running the health system and policymakers, and came up with specific ideas in the different elements of the health system that we believe, if appropriately implemented, will make a huge difference to the health of all Nigerians.
Okay. Now, how will this policy, address healthcare challenges in the country?
Right. So our vision ultimately is that if you go down to the detail of the individual recommendations, we would reach a point where there is healthcare for all. And the way to do that is a multifaceted approach. And we provide the detail in the recommendations, but I'll try to cover a few of them for you. So firstly, we think it is about governance and accountability. There are resources currently being invested in health, but not enough. We think the amounts of resources that go into health need to increase, so the envelope of money available to fund good quality healthcare. We're not talking about large amounts of money. So for example, if you invest an additional 5,000 on top of the current spend, you would be able to, per person, you'd be able to reduce the number of women over the next decade dying by about 160,000. You'd be able to reduce the number of children dying unnecessarily by about 1.5 million. And if you multiply that investment fivefold, you'd be able to reduce about 3.5 million unnecessary child deaths, and you'd be able to reduce about 300,000 women in pregnancy from dying. Now, the way to do that is both increasing the amount of money, but increasing the efficiency with which it is being spent through innovations such as strategic purchasing, through increasing coverage in healthcare and health insurance available. We also think health workforce and health planning is really important. And it's not just simply the amount of salary. Of course, the salary is important, but it's also about career structures for health workers, and not just doctors, but all cadres of health workers, so that they know they have a path to follow to provide healthcare. But in addition, we think they need to have other support in the system so that they have job satisfaction and can see that they're curing people and people are getting better. We think we need better information systems, because with appropriate information, you can challenge providers, you can challenge government, and we think the way to do this is digitization. We've shown with the availability of mobile phones, ordinary Nigerians carry them in their phones, in their pockets all the time. If you use that with healthcare workers, and technology exists, and the apps, we can be able to get to a point where we can get the right data about the care provided and the outcomes of that healthcare, and go for accountability. Because if the care is not provided, then you can check using this mobile technology to say, why am I not getting the healthcare I deserve? Others are doing so elsewhere in the world. We can do it in Nigeria. One more point. Ultimately, we think we need some level of centralization in terms of the standards and quality systems we use to govern healthcare and the guidelines that our providers need to use, and we need them done properly and once for the whole country. At the same time, we recommend appropriate localization, because the different parts of the country differ. So we think there are elements such as healthcare planning, such as making sure that whatever we're providing in our health centers are fit for the norms of each community and the cultures of each community. We need to have those localized to those communities and delivered in a sensitive, culturally appropriate way.
Okay, now you talked about digitization. Now, will this be able to reach those in rural areas?
Absolutely. The penetration of mobile coverage, mobile phone coverage in this country is remarkable. We've made huge progress. It's one of the areas of the economy that people have essentially voted with their pockets, and ordinary people have access to those. Remember, you do not need every single individual to have one. You need access to this technology, say per household, or even sometimes in a single village. And the sort of recommendations about health information system we're talking about, it is about having it in the health center. So what we are recommending is that healthcare workers in the primary care center use mobile technologies to collect data about health so that they can also be held to account, but also so they can use the information to deliver better quality of care.
Okay.
Really very interesting. Another issue, I noticed over time is the nonchalant attitudes of health workers in some of these, healthcare institutions. Do you have a provision to, challenge that, to take care of that?
So health workforce planning is an important element of our recommendation. I have no doubt that our colleagues are working in really difficult circumstances and that they are doing extraordinary feats in remote parts of Nigeria, in places with challenges around security, and providing superb and excellent care. When people are working in very challenging circumstances, it's not unusual for them to then have attitudes and behaviors to cope with the situation they find themselves in. Our report and our recommendations are that the way to go around that is to improve the working conditions of those healthcare workers. And as I alluded to earlier, it's not just simply about salary and pay. It's about the overall working conditions, the career structures that they follow, the incentives that they have to be able to do their jobs, and the opportunities they can see to progress in that career. It's not what you get today. It's ultimately where the potential you can see of where your career can end up. If we fix that, and if we increase the number of healthcare workers so that they are not overworked, then ultimately there's a path. Other countries have done it. Good examples in Ethiopia. Even Ghana is doing better than us. You go to Rwanda, you would see that with about the same amount of resource, and in some cases less, they're achieving better outcomes. We can do the same.
Okay, now will taking care of these health workers reduce brain drain in Nigeria?
Yeah. Yes. So brain drain is not a challenge unique to Nigeria.
Okay.
Brain drain is a global universal problem. And ultimately, the way to address brain drain is workforce planning. You need to think through what exactly do you need at the different tiers of your health system, in primary care, in secondary care, and you need to plan ahead to train sufficient numbers. Some countries choose to train in excess of what they need, but we need to train enough, and we are not getting there yet. We then need to make sure that when we train people, we provide them with career structures and progression that allows them to feel comfortable, happy that they are going to have the skills to make a difference. And then, of course, we need to think carefully about our reward structures and to see if we are compensating people for the level of skills they have, not just doctors, but all healthcare workers and associated professions.
Okay, now how can you actually ensure that everyone obtains the health services they need without, it being a burden on them financially?
So this is an area that we cover in a great deal of detail in our report. And our view is that you need a hybrid of a system. We need to have, for the 83 million poorest Nigerians, those that are least wealthy and least able to afford, the government, through taxation and through innovative financing, for example, the fuel subsidy that currently exists, which largely the elite benefit from, could be redirected to providing the resources needed to pay insurance premiums for that 83 million. We've calculated using detailed models that would amount to about 1.2 trillion naira to provide that cover. And then suddenly nearly half of Nigeria would have insurance coverage. But it's not enough to just put in money. You need to convert that money into good quality care. Because if you do so, those with then money in their pockets, not the 83 million, will buy the same insurance. And then the excess you generate from that, you can use it to cover everybody. So ultimately, you could end up with universal health coverage because you've utilized that tax source revenue combined with pay insurance for those that can afford to pay,
Okay.
to cover everybody.
Okay. Now, in your report, you actually talked, a great deal about, health, being of economic benefit to a country. When the people are healthy, the country enjoys and, it prospers. Can you shed more light on that?
Right. So the old adage, which I'm sure we all hear from primary school, that health is wealth, is very true. Unfortunately, health is only wealth if you invest in it and you make the difference. And the data are there. We've used Nigeria-specific data collected from our health centers to show that little amounts of money of the order of 400 naira invested in things like nutrition for kids could return a value about 15, 45-fold. And we think that there are huge opportunities to make those investments in the wider determinants of health, such as nutrition, clean water, sanitation, and indeed our healthcare. And if we do that and we do that right, then health can indeed become wealth, because those individuals would grow, be healthier, be productive, and be able to contribute to the economy in ways that they cannot do currently, because lots of people are dying from virtually preventable conditions, diarrheal disease in children, women giving birth and dying from maternal causes, and all those things are preventable with really small sums of money. So we need to get our political leaders, those responsible at state level, at local level, and nationally, to recognize the opportunity that health is in fact wealth, seize that and make a difference. In fact, the seminal thing we do in our report is think through, there's something many countries have which Nigeria lacks, possibly at the moment, but possibly ever, which is a sense of, why should I believe in the country? Why should I believe in Nigeria? And for many countries, what you do is the country offers you something in return. So we believe that health provides an opportunity to create a new social contract between the citizens and the leaders, so that Nigerians can see that they are getting something in return from Nigeria.
Right.
And that social contract we describe as one nation, one health, with universal health coverage. And if we do that right, then I believe Nigerians can buy into the Nigerian idea and be patriotic.
Okay. Now, would you say the COVID-19 pandemic has in any way, helped Nigeria carve a better path to improving its healthcare system?
So COVID-19 has devastated many, many countries. We're lucky in Nigeria, partly because of our young population, partly because Nigeria acted early to prepare for it. But nevertheless, lots of people have lost their lives from these devastating conditions. Nigeria's response, compared to many across the continent and globally, I would describe as has been good.
Interesting.
So we have an opportunity to build on that. And there are specific examples of initiatives within the COVID-19 response, which we cite in the report. For example, the private sector in particular, and the COVID effort, and the way they helped government to stock and supply vaccines and similar interventions has contributed to healthcare in substantial ways. I think what we need to do is to identify those good elements and build on them. There are obviously multiple challenges as well, which we should learn from and make sure that with the next epidemic or pandemic, we don't repeat those mistakes.
Okay, now we're actually aware that many of these particular programs rely on cheapest possible drugs, thereby risking problems of toxicity, adherence, and lots more. What makes this different?
What makes this initiative different? So I alluded to the fact that we gave ourselves a 2-year period. We brought experts from the University of Nigeria, Nsukka, from Ibadan, from Kano, Aminu Kano Teaching Hospital, as well as the very best brains internationally, from Harvard, from the UK, Australia. We came together in a room. We sat down and critically thought through. We looked at our history. We looked at all the previous reports. We collected new data from multiple hospitals around the country and clinics and health centers. We analyzed those. We looked at case studies, examples in some states where things are working, and internationally in places like Ghana and across the world. And we summarized those in those reports with specific ideas about implementation and about the things that we failed to do before. And we feel that we presented a compelling case of the sort of things you need to do that build on current knowledge and build on Nigeria's experience, and that should advance us to do better than we've done before. We do need, however, better accountability and better governance. So ideas are only good if they're implemented, and we're clear that that's what needs to happen.
Implementation is very important, and it seems to be an issue, in Nigeria with everyone, lots of good ideas, but implementation, is actually an issue. Okay.
Well, I was keen to actually ask, from what you've just said, it seems like funding is not the problem. It's the implementation of the policy that's the problem. Is that it?
So it's a little bit of both. We need better funding because per capita, our spend, it's near the top of the West African average, but well below the African average, our healthcare spend. Therefore, there is room to spend a bit more to provide healthcare, especially if it's targeted at the poorest Nigerians. But we need to spend the resources we've got better. So if you compare us, and we did a detailed accompanying paper where we compared Nigeria with other West African countries in terms of health spend and outcomes. And it's very clear that for the same amount of money, our neighbors are getting better outcomes than us. We need more efficiency. And we've described ways we can achieve that using initiatives such as what we call strategic purchasing, where you pool your monies together and you can negotiate better with the people that you're buying from and therefore get more for your money. We obviously need to block what Nigerians call leakages in the system and ensure that the resources that are invested in health actually reach the people that they're intended to reach. And there are ways that others have done that to make sure that using accountability systems, using the publication of information, ensuring that the appropriate legislation is designed in such a way that the opportunity to extract out of state-owned revenue is minimized. And those can be done in Nigeria.
Okay, now what changes will be required if the benefits of this initiative, are not delivered? And also just talk about the risks that might be likely involved and how you intend to mitigate those risks.
So our report is purposely actually optimistic because there is a danger that with all of the challenges that the country is facing, if we take the view that things are all doom and gloom, then that's the only path you'd go. The only way you get to a good place is to understand that it is possible to do so. So we take an optimistic view, but we also call it an optimistic, pragmatic view. So pragmatism relates to all the challenges I described. Our system is not perfect, so we combine optimism with pragmatism. Having said that, if we don't get this right, if our population continues to grow at the rate it is growing, if our healthcare deteriorates below the level it is at, then the consequences are catastrophic. Our failure to invest in health is actually being felt right now. The large numbers of deaths that I told you in kids under 5, Nigeria, sadly, boasts of having the largest number of children under the age of 5 dying unnecessarily anywhere in the world, no exception. Nigeria, sadly, has statistics such as our maternal mortality ratio, where the only countries that are worse than us are Chad, Sierra Leone, and South Sudan. And if you think about the wealth in this country, we can't avoid that. We have the brains, we have the resources, and we have the energy and innovation to do the opposite of that.
Okay, now just before we go, can you actually share your thoughts on a particular report that says that, there's inflation right now, 15 point, something percent, and Nigerians are actually turning to herbal medicine, because they can't afford,
Orthodox.
Orthodox, orthodox medicine. So just share your thoughts on that.
So clearly, you articulated that people are doing that because of poverty. And that is why our recommendation that the 83 million poorest Nigerians ought to have their insurance provided through taxation. Innovation, we say things like, just put 1 kobo on every minute of a mobile phone conversation and direct that directly to paying for healthcare for these poorest Nigerians, so that we avoid a situation where people are taking substances that could damage their liver. We think that it is possible to do that, and that through innovative financing and efficient spending, you could get to the point where people don't go to alternative medicine providers. There are instances where alternative medicine is of value, and complementary medicine can help people psychologically to be satisfied with their lives, etc. But there are many, many diseases that can really only be cured with evidence-based modern medicine, which we should provide to all Nigerians.
Okay. Before we quickly wrap up, I would like to ask, this initiative, for how long is the outlook like? How many years is it going to
So
be?
our time frame is a 10-year horizon, and all of our modeling and all our estimates and planning has a 10-year time frame. So ultimately, what we recommend are things that you can implement immediately, but things that you continue to do for the next decade to make things better and better, with the hope that in a decade there will be healthcare for all Nigerians.
We're looking forward to seeing that.
Yeah.
Thank you so much for coming
Thank
on the
you so
program.
Thank you very much for having me.
All right, so that was Professor Ibrahim Abubakar, Dean Population Health Sciences, University College London. Thank you so much once again.